diagnosed with rheumatoid arthritis, and I know this involves the synovial membrane of various joints, but I should call the doctor to learn more.
Rheumatoid arthritis is an autoimmune disease. Arthritis comes from the inflammation of joints. Rheumatoid arthritis can eventually lead to ankylosis, which is when a fibrous immobility of joints occurs.
I suffer from a vertebral fracture. I fractured the C6 vertebrae of my spine. I have been left as quadriplegic, but still have a close to normal lifestyle. Will you be able to tell me more?
A quadriplegic is a patient who has experienced a vertebral fracture of the cervical portion of the spinal column. This results in paralysis of all four extremities and usually the trunk. This can result in a loss of motion and sensory function below the level of injury.
Are there any other forms of paralysis?
A patient may also experience paraplegia, which is the paralysis of the lower two extremities. This can be accompanied by spastic or flaccid reflexes. Spastic is hyperactive reflexes, whereas flaccid is the loss of reflexes and tone.
I was at one of my appointments this year, and you mentioned something about a RNA test. What is that?
A RNA test is a diagnostic procedure that evaluates bone conduction of sound in one ear at a time. It's done by using a tuning fork and placing it on the mastoid process, or the bone behind the ear. Once you stop hearing the sound, you let us know by raising your hand, and this will allow us to tell if you have any hearing loss.
Hi, Dr. Gibson. My grandfather was just diagnosed with a cardiovascular disease. He calls it hardening of the arteries. But what does this really mean?
Coronary artery disease is the technical term for this disease. It is when plaque builds up inside the coronary arteries and causes the vessels to become narrow.
So it really is hardening of the arteries.
Yes, however, atherosclerosis is the term used to describe the hardening of the arteries due to the plaque buildup. With this buildup causes arteriostenosis, which is the narrowing of the vessel from the amount of plaque in the vessel. There is not much room for the oxygenated blood to get through.
Oh, okay. Can this become dangerous at any point?
As there is not much room for the blood to get through, more plaque can build up over years and eventually cause a possible blockage. This increases the risk of a myocardial infarction, or also known as a heart attack. An MI occurs when the cardiac muscle dies from not having enough oxygen delivered to the heart from the coronary arteries.
Hi, Dr. Gibson. It's me again. I'm my mother's primary caretaker, and last week she was diagnosed with varicose veins. How did she get these, and am I at possible risk for them?
Varicose veins in the legs are knotty and gnarled veins that have lost their wall and valve strength. The people who are at risk of these are people who spend a lot of time standing.
So how do you know you have this condition?
Sometimes there are veins you can see, which are superficial veins in the leg, cyanosis of the leg and/or veins that are visible. Cyanosis is the condition of having a bluish hue to the skin. Another symptom is pruritus, or itching around the skin in the area of the varicose vein.
Is this disease just a cosmetic issue for the patient?
Although they are visible and can cause one to be self-conscious of them, they also have risks that can be fatal. One of the main risks is the development of thrombosis, due to poor circulation in the veins and the valves in the veins not functioning properly. The patient has an increased risk of developing blood clots. The blood can pool in the veins and a thrombus can develop.
Is there any way of treating this condition before it becomes out of hand?
Although they are visible and can cause one to be self-conscious of them, they also have risks that can be fatal. One of the main risks is the development of thrombosis, due to poor circulation in the veins and the valves in the veins not functioning properly. The patient has an increased risk of developing blood clots. The blood can pool in the veins and a thrombus can develop.
That's great to know that there's a treatment for this condition. I need to go tell my mom. That way we will both know what's going on in case of an emergency. Thank you so much, Dr. Gibson. I really appreciate all of your help.